Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, and this is a cardiology seminars brought to you by Triple N Media from Houston, Texas. We have more than 170 lectures on our Triple N Media YouTube channel, and we welcome you to watch those videos. The feature presentation is heart failure diagnosis in the emergency department. So let's begin with the feature presentation. Here I have put together a cardiology rotations manual which has approximately 150 pages of useful information for bedside diagnosis of cardiovascular problems, and I will tell you how you can get a free copy of this manual at the end of this presentation. Whenever you see someone with the new onset of symptoms of shortness of breath, weakness, fatigue, then you always need to consider the possibility of heart failure. So we need to take a pertinent history and do a complete thorough examination. In the previous video, I talked about heart failure focused history taking. So I would suggest you to watch that video to make sure that you address all the issues that are related to heart failure before we arrive at a diagnosis. And after the initial evaluation, of course, we order the electrocardiogram. The electrocardiogram may show normal sinus rhythm, tachycardia, hypertrophy, STT changes, or previous myocardial infarctions, which may be useful or it may not be useful if it's normal. A pulse oximeter will be helpful to see how significant the hypoxia is if it is existent. If you have access to an echocardiography machine in the emergency room, you can take a very quick look at what the heart size looks like, what's the heart function is. If not, that's not essential. Of course, a chest x-ray may show evidence of a pulmonary congestion or infiltrates, atelectasis, fluid. Any of these things could go either way, either related to heart failure or could be related to infection and other conditions. Once we have done these things, we look for biomarkers like troponin. If it is elevated, it may be helpful, but if it's elevated in patients with renal failure, you want to go back and look at their chart and see what their baseline troponin levels were. Once we have done these things, the deciding factor would be the natriuretic peptide testing. There are three different varieties available: BNP, which most of you are familiar with, and there is also a pro-BNP. Then we have the MR-Pro-ANP. If the BNP is less than 100 picograms per ml, it is highly unlikely that you're dealing with an acute heart failure or pulmonary edema due to left ventricular failure. Similarly, if the pro-BNP is less than 300 picograms or MRANP is less than 120 picograms, I doubt most places do these tests, but most places are doing BNP and pro-BNP. If you have these levels, it will help you to differentiate between a cardiac origin of pulmonary edema versus a non-cardiac origin, which could be related to infection or any number of other causes. If the BNP is greater than 100 picograms per ml, or if pro-BNP is greater than 300, then we are dealing with a patient with acute heart failure, and that's when we look for causes of heart failure. Is this related to hypertension? Is this related to ischemic heart disease? Are there elevated biomarkers with EKG changes? Or is this related to valvular heart disease? Is this related to cardiomyopathy? And any number of these can be in the differential diagnosis. Once we have established the presence of a heart failure, then we are going to get a comprehensive echocardiography. And once we have established the diagnosis, we get a comprehensive echocardiography. And based on the echocardiography, we can determine what kind of heart failure this patient has. If the ejection fraction is less than 40%, we are dealing with heart failure with reduced ejection fraction. If the ejection fraction is between 41 to 49%, we are dealing with heart failure with minimally reduced ejection fraction, and if the ejection fraction is greater than 50%, associated with some degree of left ventricular hypertrophy, we may be dealing with a patient with heart failure with preserved left ventricular function or ejection fraction. So based on these, we are going to determine as what is the appropriate mode of treatment. I have done an extensive video on medical management of heart failure patients. You can watch that. If you would like to get a copy of this cardiology rotations manual, which has almost 150 pages of useful information, you can send me an email to drniknikam@gmail.com, and I will be happy to send you a copy of this book. Please do subscribe to our YouTube channel and watch more than 170 videos we have on cardiovascular diseases. This has been a cardiology seminars brought to you by Triple N Media. I am Dr. Nik Nikam from Houston, Texas, and please do subscribe to our YouTube channel. We'll see you in the next video, where I'm going to talk about heart failure device treatment.